I think like a lot of doctors, my first experience was being a patient. So as a high school junior, tore my ACL and met our local orthopedic surgeon and had to have knee surgery. And that was really my first introduction into medicine in general, but specifically orthopedics. And so it really sparked an interest in me, the possibilities of helping people get back to doing the things they enjoy doing, whether it's sports, recreation, really anything that they're interested in doing from a physical standpoint. I've really enjoyed living here in the community. I live here in Columbia, close to where I practice. It's been a great place to raise our kids. They've really enjoyed being here. I'm a native of Middle Tennessee, so it's been excellent to come back home and have the opportunity to practice here in Middle Tennessee, but also live in the area, raise my family in this area. To me, medicine's so broad and there's a lot of different opportunities to really help people. But for me, it was exciting, the opportunity to get people to doing things or back to doing the things they enjoy doing, especially from a physical activity standpoint. I enjoy being active, and I know how important that is to me. And for a lot of our patients, they're not able to do the things they want to do. And so I think it's very rewarding being able to get people back to the things they enjoy doing, things they maybe haven't been able to do for a period of time. I think really for several reasons. I think patients want the highest level of care. They want competent care. They want providers that are really on the leading edge of orthopedic surgery and medicine. But again, they want that provided in their hometown. They don't want to leave, they don't want to travel, they don't have to stay in unfamiliar hospital or unfamiliar locations. They want to be here with their friends and family while they recover and while they're cared for. I think it's a unique place as far as the camaraderie that's here with the providers and also our entire staff. You hear the word family get tossed around frequently here in association with this clinic, but I do think we have that. And I think it's unique to a lot of bigger practices. I think it's easy to lose that compassion and that family type feel, but I think that's one thing that we really have here, and I hope we continue to show that.